Hi, I'm Jen from JenThereDoneThat. Today we'll be talking about medical care and medical insurance here in Puerto Rico. As soon as you move to Puerto Rico, one of the first things you need to secure for yourself is Puerto Rican health insurance. Most employers from the States, their health insurance will not transfer down to Puerto Rico. We don't really have the same healthcare providers here in Puerto Rico that you're used to in the United States. Now, some folks, their health insurance would give them out-of-network coverage here if they're visiting, but not all US-based health insurance translates back to Puerto Rico, and we'll learn more about that later in the video. So my health insurance back in the States was right around $350 a month for a pretty decent plan. For a better plan here in Puerto Rico, I pay $180 a month. So it's a significant cost savings, and I have a much better plan, much better coverage plan. My copays are also lower. I've been recently sick this summer. My prescription copays were each in the $5. There were only a couple that were either not covered or more than the $5 copay for prescription. And my doctor's visits are typically that $10 copay. And I had to go see a couple specialists, and I paid a $20 copay for those specialists. I've also recently had x-rays and other medical tests, and they've all been very inexpensive copays. The out-of-pocket costs are very, very low. I have most of the tests that have been requested, a good portion of them are covered by my health insurance. Going to the doctor in Puerto Rico is completely different than what we're used to in the United States. Most doctors here do not take appointments. It's actually very rare to find a doctor that you can make an appointment to go see. I've actually had a couple doctors that will give you a window. So you make a 1 o'clock appointment, and 6 other people will have an appointment at 1 o'clock. And it's just a first come, first serve for that 1 o'clock window. You don't have a 1 o'clock or a 1:15 or a 1:30 appointment. It's everybody shows up at 1, and whoever gets there first is taken in that order. If you need an English-speaking doctor or English-speaking nurses, then they prioritize a little bit different. All of the doctors and dentists speak English. It's the nurses, the receptionists may not speak English, or there may only be one that speaks English. So you might have to habla inglés and ask them if they speak English, or this is a good time for you to brush up on your Espanol. One of the surprising things about healthcare in Puerto Rico is the lab work. So you go to your doctor, and your doctor will write you a prescription for lab work and then send you to an outside lab. There are plenty of them, and most of them are very good here on the island. And you take your prescription into the lab, you pay your copay, they take care of whatever lab work was requested from the doctor, and then they tell you when your results will be ready. And then you go back to that lab and pick up your own results. You then make another appointment with your doctor, and then you take your lab results into your doctor and give them your lab results. So sometimes you're actually just making a follow-up appointment with your doctor to review the results with them. We have Jamie visiting us, and she's going to talk to us about her experiences with medical care here in Puerto Rico. And then you just went to the dentist yesterday.
Love the dentist.
So great experience with the
Yes.
dentist. Now you were able to make an appointment
Yes.
for both you and your husband and go in, and everyone spoke English. And
Yes. I think just one of the hygienists speaks fluent English because our appointment was at 2. We got there at 5 till 2. They took my husband back at 2:05.
that's good.
And then I didn't go back until she brought him out, cleaned up her area, and then
So
took
you
me
guys
back.
were back to back
Mhm.
with the same hygienist.
Now I have noticed here in Puerto Rico, curb appeal is not very big in
No.
the cities. So the dentist we went to looks a little sketchy, looks like he's like in a little strip
It's
mall.
very run down on the
Yes.
outside.
But once you open up the door, it's beautiful inside. It's clean, it's sterile, everything looks nice.
So you felt like you were going to get good medical care.
Absolutely.
It wasn't a turn around and walk out
Nope.
situation. Well, that's good.
No, this is probably the smoothest my teeth have felt leaving a cleaning. So it's very nice.
So thumbs up on the dentist appointments here and the dental treatments here.
Yes.
Good. So recently your sister came to visit from the United States, and she had a lot of a medical issue here. So can you kind of just give us a brief description of what happened while she was here visiting?
Well, they came down for spring break. She was here planned on a total of 5 days. On the 3rd day, I found her in the bedroom, incoherent. She couldn't see me, couldn't hear me. We ended up calling the 911, putting him on hold long enough to get someone that could at least speak some English.
Okay.
Being in Palmas, we also had to call the front security to let them know somebody was coming, to even let the ambulance.
And maybe give them directions to find
Yes.
your house. Okay.
And security actually led the ambulance here and actually stayed until we left.
Oh, that's fantastic. Okay.
The ambulance, one of the drivers of the ambulance knew pretty decent English, probably broken English. None of the others did. But different than the States, they asked us where we wanted them to take her.
So you had a choice of what hospital.
Yes, which we had no idea. So I'm like frantically texting the group that we know, finding out, I don't even know the hospitals here. Where should we go? And a couple people said Ryder, which is why we had them take her to Ryder.
So Ryder in Umacao, which is our closest hospital.
Yes. Supposed to be a really good hospital prior to Maria,
Mm-hmm.
but right now it's just an emergency hospital.
Yeah, Ryder was completely shut down during Hurricane Maria due to damage, and now just the first floor emergency room is actually open. Okay.
So if she would have had anything simple, I think Ryder would have been great. It's really close. I think it only took us maybe 10 minutes to get there. Everybody there was wonderful. They were very nice. They just weren't equipped to handle what we would later find out would be, my sister has had sinus infections for several years. And
So she had been sick for quite some time.
yes.
And so this is an extreme case. It's an uncommon situation,
Very.
and the worst possible timing to happen while she was here for a week in Puerto Rico. So she was at Ryder, and then you guys made the decision to move her to HEMA in Caguas. So that's a different hospital
Yes.
in a larger town in Caguas.
Which is still only 25 minutes away, but much bigger hospital, wonderful, more English speakers. They had everything at the hospital, so the MRIs were at the hospital, whereas Ryder, they would have had to have transferred her to by ambulance to another hospital for the MRI and then bring her back.
So
if she needed blood, they had their own blood bank there. They wouldn't have had to have
So
called
the
out
HEMA in
for it.
Caguas is much more of the hospital facilities that we would expect, similar to what's in the US.
Yes.
So they were a comparable hospital. Now, you guys did have to pay out of pocket for the ambulance ride from Ryder and Humacao to the HEMA in Caguas. Now, tell us about that, because this is a very unusual experience for most Americans.
Yes, the ambulances here in Puerto Rico are all privately owned. So I could open up my own business with ambulances with trained people.
Jamie's Ambulance Service.
Exactly. And because so they're not owned by the government or by the state. So when the ambulance got there, they literally waited for us to pay them cash, because they will only take cash, they won't take credit card
And
or anything.
you paid them $250 in cash.
Yes, we did get a receipt.
A receipt.
But they would not transfer her until we actually paid the $250, and then they transferred her.
And over the course of this entire medical ordeal, you guys had her transported by ambulance twice, and both times was a $250 cash out-of-pocket payment before they would load her into the ambulance and take her to the next destination.
Yes.
That is very unique. Now, when she was in the hospital, you guys also had additional out-of-pocket expenses that you wouldn't normally have in the US. So you were saying that it was blankets, bedpans, Pillows was very surprising. Having to bring your own pillows to the emergency room or to the hospital for the hospital stay.
Yes, you take it for granted, because in the States, literally, the pillows, the blankets, if you need any, like she was intubated for over 2 weeks, so she started to get bed sores. They let us know that we need you to bring some A&D ointment so we can put it on her bed sores.
And
we
you had to
provided everything.
You had to go and purchase the right ointment and come and bring it. So Puerto Rico does have less expensive insurance, but I think this is kind of how some of those cost savings occur, is because you are literally taking care of that yourself, whereas I suppose in the hospital they're charging you an exorbitant amount for those same items. So you're paying for it one way or the other, but in the States you're getting that convenience factor of they already provide it, you don't have to think about it. And in Puerto Rico, you have to provide it, you have to bring it, and if you are a single person alone in Puerto Rico, it's that much more difficult, because then who do you get to bring you these things since they're not provided by the hospital? So that's a very interesting situation. We also talked about your sister had US-based health insurance, so that made a difference on what hospital she could go to in San Juan.
And I think that it also, because she does have US-based insurance, they felt we're probably not going to get paid, so she made it a little bit down the priority list.
Yeah. So that's definitely something to be aware of. As soon as you move here, get Puerto Rican health insurance. We each have SSS.
Cheap.
It's cheap. It's excellent. I know you and I are about the same age.
Mm-hmm.
I was paying over $300 a month for my health insurance plan as a self-employed person, and here I pay $180. That's about what you pay. We have the top tier of SSS insurance.
And I didn't back home.
Mm-hmm.
Because mine would have been much higher if I wanted. I mean, I didn't have like
You didn't have the top plan
cheapest
in the States.
But yeah.
So if you could give yourself any advice or anything that you would do differently about the experience with your sister here visiting, what could have made this situation easier for you?
Being that she was coming to visit, the traveling insurance, I would highly recommend that. I would never have thought about it before.
Because
I've traveled,
Puerto Rico is a U.S. territory.
Exactly.
I wouldn't have thought of traveler's insurance for a U.S. territory. I do that when I go to Europe and other places outside of the United States. So do you think she would have had a different experience if she
I think she would have had a faster, probably better experience.
the priority being prioritized?
Exactly. My parents, my grandparents, anytime they traveled, they always take like documents with them, and I always thought that was silly. I would take any information I needed, like my sister's doctor's name and number and address, all that little information that I had no idea. They're asking me all these questions. They're asking my sister's social security number. They're asking all this. I had no idea all that information.
So
like
social security number, doctors,
that she's taking.
list of medications.
I don't know that. If you're coming here to live, definitely get insurance as soon as you can. I mean, just to protect yourself, and research the hospitals around where you're going to be, because they're going to ask you if, God forbid, something were to happen and you need an ambulance. They're not going to ask you where you want to go. Well, if I didn't have a group of friends here, I would have been like, well, sir, where do you think I should go? Because I would have no idea. I think a lot has to do with like just being mentally prepared. We're not a third world country, but at times it feels like it.
It feels like it. It does feel like it.
Mentally prepared for what you're going to see, what you're going to hear, what they're going to ask you to provide.
The size of the room she was in.
Yes, because they had a lot of damage from Maria. She was in critical intensive care, which I guess was damaged during Maria. So it was an oversized room closet that they just wheeled her in and just...
That hospital had been completely shut down after Maria. I'm not sure when they reopened, but yeah, it definitely wasn't the best condition of that hospital.
I would put HEMA against maybe any hospital up in San Juan. They were absolutely
the HEMA in Caguas.
Yes, they were absolutely wonderful.
That's good. That's good to hear. And so overall, positive experience for the worst case medical emergency you can imagine with your sister visiting.
She actually just 2 days ago got released by the infectious disease doctor in our hometown. She has a slight amount of scarring that'll always be there, but the infection is completely gone.
Good. And now she can see, she can hear, she's been cleared.
I would say 99% recovery.
That's good.
And it is because as much as I didn't care for Ryder, we wanted her moved immediately. What started the process of saving her in this is when they did get there, they did automatically put her on antibiotics. It might not have been the exact right combination, but they immediately put her on antibiotics, which that's what she needed. So
right, and they didn't necessarily know that it was an infection. They were trying to rule out an overdose and a lot of other scenarios that were not the case, but that's actually good that they did start with the antibiotics just as a broad spectrum fighting. Okay, well that's good. Well, thank you for sharing your story, Jamie. We really appreciate it. It is absolutely a terrifying worst case scenario that we don't want anyone to go through, but having the information of what happened, what to expect, what you would do differently will help us all make better decisions for medical issues here in Puerto Rico. So please be sure to leave me a comment below of if you have any other questions, if I left something out, if something wasn't clear about the medical care here in Puerto Rico, and be sure to like and subscribe for more videos on living in Puerto Rico. Thanks for watching.